Hi, my name is Michelle Irving. I'm going to be presenting to you today on knowledge mobilisation and partnership research, reflections from the Australian Prevention Partnership Centre. I'd like to thank the PHAA Prevention Conference organisers for allowing me to speak to you today at this virtual conference. So as a bit of background, what is the Prevention Centre? The Australian Prevention Partnership Centre was the second of three partnership centres established in 2013 with a grant of $22 million. Our broad objectives are to generate a greater appreciation of the value of prevention among government and the community, develop tools and systems and methods to underpin a national prevention system, publish internationally significant new research in the prevention of chronic disease, and increase people's capacity in Australia's prevention community. So why is partnership research important? Well, billions of dollars globally are spent on biomedical, clinical, and health services research, but how much of this is used in policy and practice? The literature tells us that a third of patients sometimes don't get recommended care, and up to a quarter of people receive treatment that is not needed or even harmful. Poor use of research evidence in policy development processes or poor adoption of clinical guidelines at a local level can often be to blame. But there's a lot of pressures on policymakers, and there's a lot of influences on what goes into policy, such as public opinion, media, economic climate, legislative, political ideology and priorities, stakeholder interests, expert advice, resources. And research knowledge is only one part of the decision-making process. This research knowledge is often created within an organisation and within the context of that organisation, and this knowledge doesn't easily move between the organisations. Partnership research means that organisations work together to create the knowledge, and in that way it can be created to suit the context of both organisations and much more readily usable by both. Partnership research aids in the knowledge mobilisation process, which is a process that we use in the Prevention Centre to help promote this partnership research. So, knowledge mobilisation. Firstly, what's in a name? There are currently 54 different terms to describe something like knowledge mobilisation. So for ease of purpose, let's include any terms that you might be familiar with here. Knowledge translation, integrated knowledge translation, knowledge transfer, knowledge diffusion, knowledge exchange. Whilst there are some subtle differences, we are all in essence trying to achieve the same thing, moving research knowledge into policy and practice. Knowledge mobilisation is a term that has emerged from the implementation science literature. It offers a systems approach to improving the uptake of knowledge in policy and practice. It's interactive, it's multi-directional, it includes multiple activities, it needs ongoing collaborative approach, it is interdisciplinary, it has a non-linear process, but most of all, it takes a deliberative approach and it takes planning. So at the Prevention Centre, we have over 25 distinct research projects that are funded through this program. We support those projects in many areas, with one of those being knowledge mobilisation. We've taken a hands-on approach to creating opportunities for interventions that shift the thinking about knowledge mobilisation. We're taking into account that many of our researchers are proficient in translation and implementation in their field, so therefore there is no one-size-fits-all approach. We facilitate a dialogue within and across our research teams about their knowledge mobilisation goals and strategies, eliciting the lessons from their extensive experience and ultimately sharing their experience and expertise across the projects. While we are not quite at phase 3 yet, this is the goal, being able to share this across all of our projects. So what does this approach look like in practice? Firstly, I find it useful to be clear about what constitutes knowledge mobilisation. There are many different models, frameworks, and archetypes for knowledge mobilisation in the literature. I found the work by Hugh Davies and colleagues quite helpful. After undertaking empirical work in the UK with 44 organisations that undertake knowledge mobilisation, they distilled and categorised these activities down into 8 archetypes. these being knowledge production, brokering, own or wider research, advocating for use of evidence, research in or into practice, fostering networks, new or existing, advancing the field of knowledge mobilisation. In general, these all include increasing interaction and collaboration between researchers and decision makers, increasing access to and accessibility of research through synthesizing research and improving research communication, and building capacity for decision makers to engage with research evidence and researchers and vice versa, often through training and facilitation. Most researchers, when I talk to them, already undertake knowledge mobilisation activities, but this creates terminology and labels for these actions, which can be quite helpful in this process. So we found that this framework is quite useful at the Prevention Centre, as it puts a focus on working in partnership and co-production. As a part of the process of working with our researchers, we create a summary visual diagram of the knowledge mobilisation activities that have taken place or are planned within the research programs. Researchers can quickly see where their strengths and weaknesses may lie. I've created some de-identified examples into this summary today. Opportunities for networking with key stakeholders is provided and encouraged by the Prevention Centre to facilitate the partnership approach. Training is provided for researchers and policymakers to develop skills and enable them to work effectively together and ensure high quality outcomes. But we also overlay this framework with a systems lens. So taking a systems thinking approach, we focus on patterns of interrelationships and networks rather than independent forces as the leverage points for interventions. Understanding the system within which your research sits and how and where you are trying to influence is a key step to developing targeted knowledge mobilisation strategies. We at the Prevention Centre are developing a framework from the intersection of the literature on knowledge mobilisation and systems thinking as a framework for researchers. This includes a series of systems thinking framing questions to assist in understanding the system researchers are working in to be able to create change. In essence, these framing questions include: what are the goals of your research in explaining or changing a system? And how do these fit with the goals of the current system? Or can you predict any unintended consequences that your interventions might have? Or who are your key partners you need to work with to achieve these goals? And how might you enhance your collaboration or co-production with these partners? And in working with our researchers, we found this process to be quite positive. Our feedback has been quite positive, and our researchers are enjoying the experience. So for example, coming into this meeting, we prepared what we thought was our knowledge mobilisation, but I've realised that these are all under the archetype of knowledge production. I can see that we should be thinking more broadly and how we can approach this. Or I hadn't thought before how my research fitted into the bigger picture of improving health in this area. Or it made us think about how does knowledge mobilisation mean to us, about what does knowledge mobilisation mean to us and our work, and how might we enact that. And in summary, knowledge mobilisation at the Prevention Centre is about fostering and promoting research collaboration between researchers, policymakers and practitioners, supporting and developing a network of researchers with skills in research methodology, partnership and co-production, individualised iterative approach that aims to share knowledge across the centre, using a systems thinking approach to guide and design research knowledge mobilisation, which are then embedded in existing frameworks for knowledge mobilisation activities. Thank you for listening to my presentation today, and my email address is here if you would like to email me with any questions or any comments on the presentation that I've done today. And these are our partners within the Prevention Centre partnership. Thank you very much.